Welcome back. Well, our next guests have been helping people in Wisconsin with their Medicare insurance for more than 50 years. Joining us now is the president of FHK Insurance. It's Bill Kravitz, along with VP JJ Kravitz. Good morning, gentlemen.
Hi, good morning.
Good to see you both today. I know you're father-son duo, and I love that about you guys because I think people love working with a local family. Last time you were on, we talked about basically the different options for people who were on Medicare already. I want to talk about something just as confusing, and it's how and when do you sign up for Medicare? If I've got a friend who's turning 65, what do they need to know?
Well, the first thing is happy future birthday to your friend, 65th birthday. And with the IEP, or the initial election period, everyone turning 65 goes through their IEP, and it's a 7-month window, including the 3 months before you turn 65, the month of you turn 65, and then 3 months after. And so during this time, essentially, we want to determine, do we take full-blown Medicare or do we delay it?
That's exactly it. And I think a lot of people get so confused about that because in terms of retiring, like a lot of people aren't going to retire right away, right? So say my friend doesn't want to retire and she might want to work for a few more years. How does that change things?
Well, then your friend can continue to work, obviously. She would then be eligible for what we call your SEP, Special Enrollment Period. Now, the Special Enrollment Period has all the same features of the initial enrollment period. Guaranteed issue, no health questions asked, no waiting periods for pre-existing conditions. You get your Medicare Part A and B, and Medicare Part B then opens the door for your pick to any Medicare plan available in the zip code you live in the state that you live in. Now, does a person enroll in Medicare when they turn 65, even though they're contemplating continue to work on, or do they wait until another date in time? And those are very good questions, questions that everybody who's turning 65 or knows somebody that is, should be exploring, either with someone like us or Social Security or even CMS, Center for Medicare Services, because there are a lot of moving parts. Now, we do those analyses all the time. The disadvantage of enrolling in Medicare Part A and B when you're still working is that that could be duplicate coverage, because Medicare Part B comes with a premium, and of course they may be contributing something to their employer's premium. So there's an analysis that should be done. It's not slam dunk that they should stay on their group plan. How old is their spouse? How much are they paying? The drugs? There's a lot of moving parts, and we would welcome the opportunity to do those analyses.
I think that's great, and that's so important. I know my mom, for example, she retired from her main job but continued working part-time, so she needed a lot of great help and information. So say there's a viewer, somebody watching right now who is new, turning 65, how do they get all this information? That's something you guys do, right?
Yeah, absolutely. And there's a ton of resources online from Social Security. That's a good place to start. And even our website, fhkinsurance.com. And, you know, under our website, there's lots of useful resources. But first, if you go to Medicare Solutions and Products, check out our Medicare FAQs, or frequently asked questions. These are sort of logged questions, very specific to very broad range of answers as well. And these are really questions that our clients have asked us over time, and it's like a collection of really good resources there. So take a peek at that.
See, I love that you did that, JJ, because my mom has trouble hearing. And so oftentimes when she's on the phone or even in person, she doesn't hear everything that's being said. So the fact that she can go and read a lot of the same questions that she may have in the information is super helpful, even if it's after a meeting. So I love that you guys do that. For you, Bill, I remember last time we were on, you wanted to share your Medicare Minute. We totally ran out of time. So you got to share it this time.
Okay, the Medicare Minute. This is a question, it's not a trick question. And this is a question for your viewers. This is not a question for Social Security people. I know many of you work with a lot of you. You will know the answer to this. So here's the problem. And it's, again, it's not a trick question. You have two identical twins. They're each turning 65, obviously. They apply for Medicare early in their initial enrollment period, they both get different Medicare Part A and B effective dates. How is that possible? Now, if you know the answer, please email us at info@fhkinsurance.com. And again, Social Security people, we cannot give you a gift. Please don't write in with the answer. And we will be back in 2 weeks from now on a Monday to reveal the answer. Again, it's not a trick question. I'll repeat it one more time. 2 identical twins, each applying for Medicare early in their initial enrollment period. They each get different Part A and B effective dates. How is that possible?
Oh my gosh, I totally don't know the answer. So I hope someone out there does, and they'll email you. I'll give the information again. But JJ and Bill, thank you so much for joining me today. Good to see you both.
I want to just do one quick shout out to our general manager, Mike Johnson, who's watching us tonight or this morning, and he's a little sick. Mike, get better. We need you. Thank you.
Yeah, get better, Mike. That was really sweet. Good to see you guys. Take care.
All right. Thank you.
Thanks, everybody.
You bet. All right, not only is FHK offering a free gift for the correct answer to that Medicare Minute question, but they're offering a free prescription review as well. You can talk to a licensed agent just by calling them. It's 414-228-7555. There's no cost. There's no obligation. They're happy to answer all your Medicare questions, and I love this. They'll do it whether you're their client or not. You can call them with a question even if you're not currently working with them or don't even plan to. They'll work with you and help you answer some of those questions.